It was a beautiful September afternoon, September the 9th, Friday, and I was planting a tree out here that had died, and I had the trailer hooked up, and I thought, well, while I put this equipment up, I will pick up all the limbs. And I reached over to get a limb and fell off my tractor and turned the steering wheel, and it run over me about 3 times.
A tractor accident left Dave Mitchell with a severely torn ankle. He was so injured that he was unable to walk. He needed medical care at home while he recovered and found it with the qualified nurses at Spartanburg Regional Healthcare System Home Health Services.
They have taken, let me say, the anxiety out of this thing. You know, this for a man, this is an awful thing to happen. It robs you of your ability to walk and to do things. And they have taken up that void in my life.
Spartanburg Regional Healthcare System Home Health Services provides experienced staff and compassionate care to patients who are suffering from chronic diseases or need healthcare management in their home.
It provides a full continuum of services with an individualized plan of care that is worked on collaboratively with the physician and the patient and the home health agency. We have nurses who can go in, monitor blood pressures, help with medication administration, all of those sorts of services that would encompass people who have the chronic disease needs.
It's so convenient. I didn't know it existed. But it's the best thing that could happen to me in the situation I was in. The first day they came in, they went to check the medication, check where I slept, they checked the house, they looked to see anything that needed to be done here. I depended on them, and I still depend on Jill, and I look forward to seeing her every morning, or twice a week now.
In addition to skilled nursing services such as ongoing assessment of rehabilitation needs and potential, home health offers certified wound and ostomy care, medical home social work services, and physical, occupational, and speech therapy services. These are just a few of the many services offered. Many patients who need these services have chronic obstructive pulmonary disease, congestive heart failure, diabetes, and wound care needs.
There are not nearly enough people going home with home care, period, after hospitalizations. I mean, for most patients, certainly in the 55 and older population, almost all of them would benefit from going home with home care certainly after an acute care stay.
Spartanburg Regional Home Health Services has served in Spartanburg County over 35 years and has recently expanded its services into Greenville, Cherokee, and Union County. In Spartanburg alone, more than 600 patients are provided care every day. The goal? To help patients recover within the shortest possible time and help them achieve their highest level of potential in day-to-day self-care activities.
The things I think are important for patients that are being turned back over to home health or turned over to home health is 3 big parts. The patient or their caregiver needs to have the ability to appropriately manage their medical condition. They need to be safe in their home, and they need to be as independent as possible with all of the activities of daily living, etc., that are important to them. From that, you're going to improve quality of life.
Home health services help prevent unnecessary readmissions to the hospital, which can become very costly. Patients are more comfortable in their home with the health care coming to them for their needs. Without these services, getting proper treatment would be much more difficult.
It would be very difficult. They would probably return to the hospital, have unnecessary hospital readmissions, unnecessary trips to the emergency room, and more frequent visits to the physician's office. And when they're ill, and when they're that ill, it's very difficult to get out and make all of those journeys.
It's also extremely helpful to the patient who get home health care because of what it offers. Continuum of care.
It's very important that the patients who are leaving these facilities and going into their home have that are able to maintain that connection. And those are areas where Spartanburg Regional now has a very big presence from the standpoint of taking care of acutely ill patients, but did not have that presence on the home care side. And maintaining that connection through the system where all the information is readily available in our electronic medical record and to our physicians, I think is just very important.
They are absolutely wonderful. I'm doing fine. I go see the wound doctor tomorrow. I'm hoping that she's going to say, Dave, why don't you start driving again?
Spartanburg Regional Home Health Services, offering experienced and compassionate staff, the ultimate quality of care, and a commitment to the highest level of service. For more information, give us a call and talk with someone about how your family could benefit from home health services.